Epley. After you wash your hands, securely support your patient's head and cue them to grab onto your forearms. Turn their head 45 degrees and drop them down into supine with their head extended at 30 degrees. Hold this first position for at least 1 minute. The patient may require constant cueing to keep their eyes open. Observe for any nystagmus. While keeping the patient's head secured, rotate to the other side. Reposition yourself for proper body mechanics. Ask your patient if they feel supported, and if they're having difficulty keeping their eyes open, you can support their forehead. After another minute or so, cue the patient to roll onto their left side, or the unaffected side. This will take the patient through a neutral position as you lower their head down 45 degrees. Finally, help the patient to an upright seated position. Semont. Securely hold the patient's head and cue them to cross their arms across your forearms and pull down. When ready, bring them down to the affected side first with their head rotated at a 45-degree angle. Have the patient get comfortable as they'll be here for about 3 minutes, and you can be by their side watching them. After 3 minutes, securely hold their head again and quickly, within 1 second or so, flip them over to the other unaffected side, this time with their head down at a 45-degree angle. Allow the patient to get comfortable again for the next 3 minutes as you continue to monitor. When time is up, securely bring the patient back to a seated position. Monitor for symptoms of vertigo. Foster.
Start kneeling and look up quickly towards the ceiling. Forward fold down so the back of your head comes down to the mat with a slight chin tuck. Wait until any dizziness subsides before moving on. Rotate your head 45 degrees so that you're looking towards the right elbow crease or the affected side. Keep your head to the right and quickly raise your head to shoulder level. Count to 15 before moving on. Quickly raise your head to an upright position, keeping your head slightly turned towards the right. As vertigo subsides, slowly sit upright.
Deep head hang. If your patient is experiencing anterior canal BPPV, bring them back into a deep head hang by bringing their head into full cervical extension so that they feel supported, cueing them to keep their eyes open, especially if they're experiencing dizziness. Then bring their chin into a neutral position and hold here for the next minute. Finally, bring their head into a chin tuck position and again hold here. And then at the end, bring them into a seated position by giving them a little bit of support. BBQ Roll. If the patient is experiencing horizontal canal BPPV, bring them back on their affected side first at a 45-degree rotation. After a minute, switch to the unaffected side. Then roll the patient over towards their stomach, holding here another minute. This should resolve most of the dizziness. Afterward, bring them back into side lying. They should feel mostly resolved by now, and then finish by bringing them up to a seated position